program. So hello, welcome. My name is Meredith Kwok. I am the Associate Director of Alumni and Constituent Relations for the Program in Public Health. And this is the UCI Public Health Lunchtime Lecture Series, Episode 8. As you know, the intention of this series is to inform and engage our community in public health efforts that are happening right here in our backyard by highlighting the work of our faculty, all in an easy to digest manner over your lunch. It's a critical time for public health on a global and local level during the pandemic, and also on a campus level. As you know, our program is transitioning into a school. So our time is short. I'm going to introduce our very special guest, and she will present for a few minutes and then open up the room to a Q&A. We will use the Q&A function, not the chat, found below, and this will be recorded for future viewing purposes. So with us today is Dr. Bernadette Boden-Albala, the Director and Founding Dean of the Program in Public Health in the Susan and Henry Samueli College of Health Sciences here at UC Irvine. She is also a professor of epidemiology and population health and disease prevention. She is an internationally recognized expert in the social epidemiology of stroke and cardiovascular disease. Over the past 15 years, her robust research portfolio has focused on defining and intervening on social determinants of disease, including the role of sex, race, ethnicity, socio-economic status, social support, stress, and social networks on stroke disparities and patterns across the US and globally. In addition to her clinical interventions, Dr. Boden-Albala is PI of the National Institute for Minority Involvement in Neurological Clinical Trials, which has built a toolkit of materials to improve racial ethnic minorities and women's participation rates in neurological clinical trials. Dr. Boden-Albala joined us last summer, coming from NYU, and we're so thrilled to have her with us. Little did she know that she would not only be moving across country for leaving New York for the first time ever and starting a new job, but also entering into a global pandemic, wildfires, heat waves, etc. So we have surely given her the warm Southern California welcome, but she has risen to the challenge as our in-house expert and our fearless leader. So Dean Boden-Albala, I turn it over to you.
Thank you so much, Meredith, and everyone. It's really my pleasure to be here. When Meredith and I were really planning this, it was months ago now, and we were all hoping, I guess in vain, that we would be able to travel. Maybe we'd still be under some kind of cautionary, but certainly not where we are today with COVID, still 14 million cases in the US as of today. It's just, it's unbelievable. And so I think I really want to spend a few minutes of time talking. We're coming up to the holidays. We just had a holiday. It's been almost a year since COVID's been around. And a lot of us have not taken any breaks, no vacations, nothing. It's extremely stressful. And I think we're all sort of dreaming about, can we get some kind of holiday in? What does travel look like? And, I love travel. I'm a big traveler. Before I came to UCI, I spent a couple of years, basically at least half the year, out of the country doing, starting up public health programs throughout the world. I don't think that I have ever in my life been, had a period of time not being on a plane as I've had during COVID and not really experiencing other cultures, other foods, other people. So it's been tough, but I really want to be cautionary here, although obviously decisions are up to you. So, so the first thing I want to frame this discussion a little bit is in thinking about and always talking about how do we reduce our risk. And our risk here, of course, is exposure to COVID, our risk and all of the risk of folks around us, because we might be exposed. Again, there's a huge asymptomatic population here, maybe upwards of 40% of people who get exposed, who don't think they have COVID, and then who spread the disease. disease. And so always remember with COVID, it's about hand washing, sanitizing, face coverings, and physical distancing, and avoiding crowds is critically important. And I think that's going to be a challenge if you think about traveling. And the other thing that we've moved from, because we've been in this so long and we know about the distancing and the masking and the staying home, is that really this is about what I would call harm reduction. And so whatever decision, and we're going to move to travel in a minute, but whatever decision that we make, the context within which we make that decision should be about harm reduction. How do I live my life as I need to within the constraints of policies in society, but there's still wiggle room? How do I live my life and make sure within COVID that I'm doing the least amount of harm to myself and others? And so this harm reduction model, a model that we used in the HIV/AIDS epidemic, a model that we're using now in a lot of cardiovascular disease reduction. And so every step you take to reduce COVID is better than not taking any step. And so, choice one, you can go out or not. And if you choose to go, wear a mask and wash your hands if you're going, right? So the safest way not to be exposed is not to go out. But most of us, I think, would agree that that's very, very hard to do. You can go to a public place or not. If you choose to go to a public place, you should go at a time when there's not a lot of public there. So really thinking about doing things at off times when you reduced crowds, or if you go someplace, even just around here locally, that you're always focused on going when other people are really not there, when there's really that reduction in the number of people. When we could, before Purple, eat in a restaurant, you could choose to eat in a restaurant or not. And if you choose to go to a restaurant and when they're open again, you can choose to eat outside versus inside. And so think about all of your behavior as, what am I going to minimize my risk, but still weigh some quality of life that I really need to participate, that I really feel I need to have. Because being home alone and isolated for 8, 9 months, almost a year, is it's extremely difficult. There's a lot of depression and anxiety. We know this year. And so again, it's all about weighing risks. And the last choice, exercise in organized groups or not. And this is a key one. You said you choose to do the best thing. Maybe it's best to choose to be in your home or versus an outdoor space, or outside and socially distanced. Again, with others, that's the least, I think that's the most risky choice, but again, making these choices. So there's sheltering in place, there's harm reduction, and then of course there's all the way to no protective health behavior, which of course is absolutely not good. So, and then just also remembering that whether you're traveling abroad, traveling in the US, or just traveling down the street to see friends and family, risk is greatest with COVID when you're sharing a meal, when you're singing or shouting, and when you're going to bars, parties, and other social events. And that's really, I know that's a bummer for everybody, because this is the time of year that we do all of those things. And so really trying to move back that risk, cut back that risk. And so let's go back. So what are updated CDC recommendations on travel? And this is, we're just going to frame this CDC recommendation on travel, and I'll talk a little bit about international. But CDC basically says travel can increase your chance of spreading, getting COVID, and that you should postpone holiday travel, all travel, and stay home. It's the best way to protect yourself and others from COVID. Re-emphasizing the point that you may feel fine and may not have any symptoms, but you still are able to spread to friends and family and the community that you're traveling within and after travel. If you have known exposure to COVID, if somebody you know that you you've been in contact with us had COVID, you should delay travel. If you don't feel well, you should delay travel. Quarantine yourself and get tested and monitor your health. And then, of course, we know checking with local state health departments. And then again, do not travel if you are sick or test positive, and don't let anybody else in the travel party travel with you. So why do you want to travel during a global pandemic? Well, there's a lot of reasons. I think the biggest, and I've alluded to this before, and Meredith and I were talking about this a little bit, even before I got on here. We're tired, we're fatigued. We need that Caribbean trip. We need, Bora Bora. We need New York City for those of us in the Northeast. And so there's this great pandemic fatigue, and it is real. You've done a really great job, but you just feel like, I just can't take it anymore. And the truth is we need a few more months and then we'll be okay. But the question is, how much can you get through? Can you get through those few more months? You may really have family obligations. I think that the CDC would like to tell you that, everyone should just stay home and everyone should be fine if you're home, nobody intermingling, no family obligations, but people really do have family obligations. Maybe, there's somebody who's very, very sick that you need to see, maybe for the last time. There may be work-related or research or other kinds of issues. You may actually be stuck someplace and need to travel back, because we've had this ebb and flow of cases, and things were a little bit more relaxed for us, if you remember, in June, and then again a little bit in September. And so maybe you're out and now you need to get back, and then some other unusual circumstances that take you out. So really, let's talk about protection and how to say, if you've decided you need to travel during the holidays, that you've made this decision, it's the decision you're going to make, let's try to think about keeping you safe. And I just want to say one thing about pandemic fatigue. The big reason to the urge to go out and to travel, of course, is that you're exhausted and you're tired, and this impacts on your mental health, and it poses new risks, because in some ways you say, you know what, I'm just going to get this anyway. I'm just going to be maladaptive in my behaviors. I'm not going to wear a mask, or I don't care. And plus, people in my age group, well, they don't seem to get it so badly. So be very, very careful if you're feeling that way, and talk to somebody, because that's a dangerous place to be. So how do you want to travel? If you're going to travel, you're going to travel by car, bus, plane, train. They're all very different. Car is actually very protective, right? You're really in your own bubble the whole time. You can be the person who decides when you stop, where you stop. If you're going to stop at a hotel, for example, if it's an overnight trip, you can choose what kind of hotel. Choose a hotel with an air conditioning unit, heating unit that is external is better than internal. Choose a chain and find out what that chain is doing with COVID. I did drive back to New York in August and needed to move everything out here to the West Coast. And so I did a Marriott chain. I made sure that every chain had outdoor units. Even though we had to walk into the room, everything else was out facing. The air was going between my room and outside. Had my hand sanitizers, really remained very touchless in everything that we did. Credit card, reservations, everything touchless. And the journey was actually absolutely fine. Called ahead, picked up food. So there are ways that you can do this. Home away from home, going from your home and renting a home. And there's a lot, even some of the big hotel chains now have these homes that they're doing. And people think, maybe a home away from home is good. I can bring in family, and we'll talk about that in a second. Virtual travel, that's what I suggest. So there's these wonderful, links now. You can do things like ghost walks in Prague, or Martha's Vineyard or Nantucket. And so maybe, get the food of the region, a good bottle of wine, and turn on your ghost walks and just picture yourself being in that region. and plan for that trip post-vaccine. Traveling now safely takes longer. And so to really travel well, you have to get home, you have to see that aging parent, something is up, you need to go. The right way to do it, if you decide to do it, you need to quarantine and test. So something like before you leave, quarantining for 14 days or quarantining for 7 and testing. After you test, until you leave for the airport, do not go out. Really sequester in that, or quarantine, I should say, in that period of time, knowing that you really haven't had any exposure. Now, planes, trains, automobiles, there's exposure there. And so even though you've quarantined and you're getting now on a train or a plane or whatever, and you're wearing proper protective equipment, your mask, your hand sanitizing, when you get someplace else, you've now had the travel experience. And so what you really need to do there is you need to go back and quarantine again and test again. And you should not go and see anybody else, especially high-risk people, but really anybody else, until you've gotten that negative test. And there's lots of ways all across the United States, you can get testing now, basically. Fire departments are testing. You can get tests at Costco. There's all sorts of ways to get testing. You have to remain true to that regimen. And so think about, though, what I've just talked about. I've already talked about 14, 21, 28 days, if you will, before you've actually seen anybody, right? So it's a month preparation. Then you're there. And then you're going to go back home, and then you're going to need to be in California and other states quarantining again. So it really has to be a dire circumstance that would take you to do all of this action. And so that's why I say travel safely takes longer. Travel isn't easy, and it requires a great deal of preparation. If you're deciding to go internationally, understanding international restrictions and entry, you'll get out of this country, but can you get into that other country? And does that other country also require quarantining and testing? And it's one thing to be doing testing here in this country. It's very, very difficult to be thinking about testing in some other country. Insurance, making sure that you can cancel up to that minute. If there's a huge spike in the country, say you want to go to a country where the positivity rate is still pretty low, it's hanging out about 2% or so. It seems like it's a safe place. You're going to rent a place there. Just make sure, though, if something spikes or if the country is in lockdown, like the UK is in lockdown. The UK just came out of lockdown yesterday, but the UK was in lockdown. You need to make sure that you've got insurance, you've got cancellation, and your insurance should not just be about canceling your trip, it should be about healthcare, because what if you do get sick? And here's the other thing, so how am I going to get sick if I've quarantined and tested and quarantined and tested? Well, you may not get COVID, but you still may get sick with something else. And if you're in a place, and that's here or other places that has an infrastructure that's really being tested, their ICUs, their hospital beds are at capacity, you don't want to be there in that region unless you have to, because if something happened to you, you had a heart attack or you broke your leg, you may not get the treatment that you want because you're not going to be put at the priority, because COVID and COVID care right now really is the priority. And again, making sure way before that you know that you have a place to quarantine, that you know that you have food places you can, buy your food, that there's testing or that you have testing, so that when you get there, you do that. Always pack and prep soap, hand sanitizer, a mask supply. Do not go anywhere with only 2 masks. What happens if there's no washing machine dryer? So you really need supplies of all of this. And always make sure that that you have reservations, that you've asked about what their COVID restrictions are, what their COVID policies are, et cetera. And then once you get there, once you get there, you have the same kind of issues, right? You're in one place. What are you going to do when you get there? So, you know, I think about, oh, I want to go to Paris. Well, I want to go to Paris because I want to go to the museums. Well, museums, are they open? They're not. You don't really want to go into indoor space. So if you're thinking about traveling, you have to think about, it's not the Paris that I want to go to, it's the Paris that's restricted. There are curfews as well. Things have to shut down. And sometimes, again, when infrastructure is very, very taxed, and I do a lot of work in Africa, and so when infrastructure is very taxed, safety concerns are an issue because, again, everything's focused on providing as much infrastructure to the main problem. In the Ebola pandemic in Africa, systems collapsed everywhere, infrastructure, road systems, everything collapsed, you know, because all attention was on the epidemic. So safety, social distancing, all of that. The race to a vaccine. So, all right, so maybe you're not going to go for Christmas. Sorry, guys. Bad news. I think that you just saw that this is a huge amount of effort to be safe. Isn't it easier to be safe in your own home with a Zoom? But we are in a race to a vaccine. There are vaccines. UK just approved a vaccine. We're on the 10th. The US is looking at the Pfizer vaccine, and the Moderna vaccine is right behind it. There will be a tiered system. There will be rollout for these vaccines. And so when you get a vaccine, can you travel? And so the question is, yes, but you still need to spend, at least for the 2-dose vaccines, at least 6 weeks before you go anywhere from the first dose. It's a 2-dose vaccine, and then after all of that, you still need a week at least for the whole thing to take effect. Just because you have a vaccine doesn't mean that everybody else has a vaccine. It means that virus is still out there. It means that there's still curfews, still infrastructure issues. So spend a little bit of time having fun and planning that travel, but be realistic about when that travel can occur. It takes a long time. It's going to take a long time to return to normal. And again, in that planning, check infrastructure, health and non-health, safety, other issues. You still will have to wear a mask. So that's the other thing. So I'm going to choose to go on a cruise in June. I think it'll be okay. I'll be vaccinated. This is a hypothetical. My husband will be vaccinated. The family will be vaccinated, but we'll still be on a cruise. Maybe they'll require vaccination. That would be great. Or maybe they'll require masks. And so here I am now on my big post-COVID journey, and I'm still wearing my masks, and I'm still using my hand sanitizer, and I'm still eating in my room. So be very realistic about what that looks like as well. I mentioned bespoke adventures. I bet they will come out. These are sort of adventures that they gear to individual clients. These are expensive, but again, even in bespoke adventures, you have to go from where you are to there, traveling in places that where people haven't been vaccinated, where there could be a run on vaccines. There's still a lot of disruption that's likely to take place. So I'm going to end with and take questions. If you don't have to travel, don't travel now. One more Zoom holiday. We're one more Zoom holiday until we're really able to sort of get out there. But if you must travel, be realistic and be prepared. Thank you very, very much.
Thank you, Dean Boden-Albala. Sometimes the truth hurts, but I appreciate you being honest and also very realistic. And no one predicted we would still be here now in December, almost in year 2021. So we do have a few questions from our audience. One, I think you just answered before you close, but you may need your crystal ball for this one. When do you foresee travel returning towards more normal? You said a long time.
I said, so right. So I think realistically, we're going to be back to traveling a bit, probably by mid-June. And I think that those of us who are, avid travelers will be the first out the gate. I think there'll still be a lot of people who will be reluctant to travel. But I think we're going to start to see things getting back to normal in the United States, where we will be saturated with vaccines much earlier. I think we're really going to have to watch the global landscape. I don't know what's going to happen there. That could still take another 6 months plus.
So patience, more patience. We have two related questions about having COVID. So if somebody had COVID-19 and now tests negative, are they still at a risk for reinfection, or could they potentially be a carrier to infect somebody else?
So what it looks like, we really weren't able to answer that question March, April, May. It looks like they probably have an excellent immunological response. If I were them, I would be interested in getting my antibodies tested. And so I think that most people would say that they probably have a low risk or no risk at this point, but we still don't know what that of getting COVID in the near future. But again, we don't know how long this immunity is really going to last. Is this going to end up being more like flu, but maybe 2 years, or is this going to be something longer lasting, 5+ or more years? So we still don't know. The other thing is, if you really had a bad go at it when you had COVID, be careful and don't put yourself in a vulnerable or high risk situation. There are some post-viral syndromes that have come on post-COVID that we're just really starting to understand them. So I would say still be careful. Yeah.
As you just said, we're still trying to understand the vaccine. It's all very new, but another audience member is asking, if an individual has tested positive for COVID, is it recommended that they get a vaccine?
That's a great question. I'm on the Orange County Healthcare Agency task force for the vaccine. And I have to say, I think that most people will say, yes, it's recommended that everybody gets it. At least I think that's what people are talking about now, but we'll have to wait and see. We still don't have any full approval. On the 10th of December, the FDA will be having an open hearing on the vaccine, and I definitely think that's going to be a question that people are going to want to know. I haven't seen the science. I've heard good things, but I haven't seen the science behind these vaccines yet.
Patience, patience, patience. I know we're just a few minutes over, but since we started a few minutes late, I'll just take one more question. Can you describe some of the post-viral syndromes that you just mentioned?
Sure. So a lot of what we're seeing right now is sort of a plethora of neurological syndromes that have to do with, sort of neuropathy and pain. All of a sudden sort of feeling like maybe you had some kind of a back injury and pain radiating down your arm, things like that. That's right now what we're seeing. Obviously, there's some folks with clotting disorders, fatigue. And so we're just researchers around the world are just trying to figure out what the clustering of those syndromes look like.
Okay, thank you. So I think the moral of the story is hang tight, everybody. Thank you for joining us again for episode 8. Thank you, Dean Boden-Albala. I know your schedule is jam-packed, so we appreciate you taking this 30-minute lunch hour to spend with us. For our audience, a follow-up email will be sent with links to the recording and more ways to support the program in public health here at UCI. We will be back here next Thursday for episode 9 before the holidays. That's December 10th at 12:30. And this is featuring our colleague, Dr. Salulas. He's the director of the COVID-19 response team here at UCI. And he'll be discussing COVID-19 in our campus. So we look forward to hearing from David about what is happening right here in our backyard. So again, thank you, Dean Boden-Albala.